Welcome. In this video, we'll walk through key coding steps for radiology X-ray services, covering CPT codes, imaging views, charts, ICD-10 tips, and common pitfalls to avoid. Let's get started. 72170, Radiologic Examination Pelvis 1 or 2 views, X-ray showing 1 or 2 views of the pelvis. 72190, Radiologic Examination Pelvis Complete minimum of 3 views, X-ray showing at least 3 views of the pelvis. Pelvic radiographs include many specialized views, not just standard AP. Each is designed to visualize specific pelvic structures, hip joints, or sacroiliac SI joints from angles that reveal different pathology. As a medical coder, understanding the purpose of each view helps ensure accurate CPT code selection, especially when CPT codes are view-dependent. Standard and pediatric hip evaluation views pelvis AP view, this baseline image of pelvis and proximal femurs. Bilateral frog oblique AP. This view is used in pediatrics for evaluation of the femoral neck and head of both femurs. This view is taken on a patient small enough to fit in one exposure or film. Fracture and trauma evaluation views are specialized angled views. They include inlet view Lilienfeld, outlet view Taylor, PA axial inlet Staunig, acetabulum oblique Judet, ilium views APPA oblique. These views are for pelvic stability in SI joints. Flamingo view, Ferguson view, pelvis lateral, pelvis PA view. Radiology report, order exam, pelvis 1 or 2 views. Header, AP, pelvis radiograph, history, injury, follow-up fracture, comparison, 10/14/2022. Findings, prior right acetabular ORIF. No interval hardware complication, alignment is unchanged. Moderate joint space narrowing and subchondral sclerosis of the right hip. Impression, uncomplicated right pelvic ORIF, post-traumatic right hip osteoarthritis. Let's look at the views. AP pelvis, that's a total of 1 view. This qualifies for CPT code 72172 Radiologic Examination Pelvis, 1 or 2 views. Now let's choose the appropriate diagnosis code based on the clinical history and chart findings. Report findings state this is a follow-up or subsequent encounter. The patient had a previously documented right acetabular fracture. The ORIF hardware is being routinely followed. The fracture is healing normally. The most appropriate ICD-10-CM codes are S32.491D, other specified fracture of right acetabulum, subsequent encounter for fracture with routine healing, and Z, 98.1, arthrodesis status. The correct codes for this report are 72170, Radiologic Examination, Pelvis, 1 or 2 views, S, 32.491D, other specified fracture of the right acetabulum, subsequent encounter for fracture with routine healing, and Z, 98.1, arthrodesis status. Radiology report, order exam, pelvis 3 views, header AP, inlet, outlet, and bilateral Juda views of the pelvis. History, follow-up fracture. Comparison, 1/8/2023. Findings, bones are subjectively demineralized. Left total hip arthroplasty hardware appears intact without asymmetric polyethylene wear. A proximal most circlage wire fixates a chronic fracture of the greater tuberosity. The femoral calcar is significantly deficient. Subacute to regular left obturator ring, lateral lumbosacral, and left acetabular fractures appear unchanged in alignment. There is no significant interval healing, severe vascular calcifications. Impression, subacute to chronic left pelvic fractures without significant interval change. Let's look at the views, AP, inlet, outlet, and bilateral Judet views of the pelvis. That's a total of 5 views. This qualifies for CPT code 72190, Radiologic Examination, Pelvis, complete, minimum of 3 views. Now let's choose the appropriate diagnosis code based on the clinical history and chart findings. Report findings state, chronic fracture of the greater trochanter, not the primary focus of this exam. Subacute to chronic fractures in the left obturator ring, the lateral lumbosacral area, and left acetabulum, with no significant interval healing. Left total hip arthroplasty hardware is intact. The most appropriate ICD-10-CM codes are S32.492G, other specified fracture of left acetabulum, subsequent encounter for fracture with delayed healing. The patient had a previously documented left acetabular fracture. S32.56XG, fracture of left pubis, Subsequent encounter for fracture with delayed healing. Obturator ring fractures are mapped to the pubis. S32.81xg, fracture of other parts of pelvis, subsequent encounter with delayed healing. Used for lateral lumbosacral junction fracture when no more specific pelvic fracture code exists. Since this is a follow-up imaging encounter for fractures that show no interval healing, we must code them as subsequent encounters with delayed healing using the appropriate 7th character G. The correct codes for this report are 72190, radiologic examination pelvis, complete, minimum of 3 views, S32.492G, other specified fracture of left acetabulum, subsequent encounter for fracture with delayed healing, S32.56xg, fracture of left pubis, subsequent encounter for fracture with delayed healing. S32.81xg, fracture of other parts of pelvis, subsequent encounter with delayed healing. Thanks for watching. Be sure to check the links in the description for helpful resources and subscribe for more radiology coding content. CPT is a registered trademark of the American Medical Association, AMA. CPT codes are used in this video for educational purposes only and do not reproduce CPT descriptors in full. This video is not a substitute for the AMA CPT Professional Edition or official coding guidelines. Verify all codes with the most current CPT code set and payer policies before claim submission.